A new tool benefiting men diagnosed with prostate cancer is now available in Central Oregon. Bola Badabo explains why it can be life-changing.
The tool called PSMA PET-CT saves patients from traveling all the way to Portland, Seattle, or San Francisco to identify the spread of new or reoccurring prostate cancer. It's been available locally since June 1st, already treating about 36 patients.
It allows our local patients to stay in Central Oregon for this exam that helps their urologist and oncologist determine the extent of their disease and then pick appropriate therapy.
The PSMA PET-CT was approved by the FDA in 2021. Only recently it became available at Central Oregon Radiology Associates in partnership with St. Charles Health System.
Other similar imaging agents of this type were historically used for looking only for recurrent disease. This new test does dual purpose.
The test is used to identify a new or reoccurring spread of prostate cancer after a patient has already been diagnosed.
There's a lot of patients that need this exam, and so we're trying to meet that demand right now.
Prostate is the most common cancer in American men. According to the Center of Disease Control and Prevention, 13 in 100 men get prostate cancer. The American Cancer Society estimates more than 288,000 new cases of prostate cancer for this year and predicts nearly 35,000 deaths. Here's how the new tool is being used at Cora in Bend. A patient is injected with a radiotracer dose, which is what helps provide the imaging exam. The patient then waits an hour in this waiting room so the agent can spread.
So this runs the PET-CT, and we enter the patient demographics in here, and then we select the correct protocol that we would use for that patient. The patient goes into the scanner, takes about 20 minutes or so to do, and then we do some post-processing here.
Results are sent to the patient's doctor within 24 hours. Right now, the procedure is offered only a couple times a month since the dose has a short shelf life and needs to be brought by air from Portland. But already, local doctors are impressed with the results.
It's fantastic. It really is a game changer. It changes their treatment because we find stuff well before it's visible to CT or MRI.
Cora hopes to increase the number of days the testing is offered locally. That depends on finding ways to increase the availability of the tracing agent known as Pylarify. Bola Badabo, News Channel 21.